For the past 20 years, Promises Treatment Centers, located in Malibu and West Los Angeles, have provided effective methods for patients to overcome their alcohol and drug addictions. We spoke with the CEO of Promises, Dr. David Sack, who discusses the guidance, treatment, and support they offer to each individual as they journey through the recovery.
Promises has a long tradition of 12-step facilitation treatment. We feel that the best chance for long-term stable recovery is if we can get individuals during the time that they're with us to start to participate in 12-step meetings like Alcoholics Anonymous and Narcotics Anonymous, where they can get mentored and where they can get support. A very significant part of our philosophy is to help people see that they've become helpless in the face of their addiction. People come to addiction really through two pathways. They start off as recreational users and it becomes a habit and they can't give up the high. And then there are people who are in psychic and emotional pain where addiction really becomes an escape from that pain. So part of what you have to look at with individuals is why they would stop. What's in it for them? What are the benefits?
We asked Dr. Sack what a day is like for their residents.
Well, most days start off with participating in a 12-step meeting where they meet with other individuals who have addictions, who frequently will relate their stories about their addiction. That's usually followed by an intensive psychotherapy group therapy experience, a process group, where some of the historical and emotional issues that may have contributed to their addiction are explored. Well, the minimum time that someone would be admitted to Promises for is 30 days. The reality is that many people have very complex problems, and so it is not unusual for people to extend their treatment beyond that 30-day period. So we have many clients who might be here for 37 days or 45 days because we really try to individualize the treatment to mitigate the risk of relapse. We measure success by whether our clients follow up on their treatment plans, whether they go to community treatment, do they get a sponsor in their AA meetings, do they follow up with their therapists and psychiatrists. And as of today, Promises has literally thousands of alumni that actively participate in our alumni program. Many people who have drug or alcohol problems have other, what are now being called impulse control disorders or soft addictions. So we frequently encounter individuals who may gamble compulsively, or who have sexual addictions, or who have problems with video gaming where they can't stop indulging in video games. So that there are a range of other problems that are compulsive in nature. Hoarding food is another one. We have people who hoard objects and food. So that we see other repetitive compulsive behaviors that are frequently encountered in the course of addiction. Treatment team is comprised of licensed therapists, alcohol and drug counselors, and rehabilitation technicians who provide supervision, as well as other specialized therapists, equine assisted therapy, yoga therapy, acupuncture therapy, that all help to reinforce the treatment approach. It's an extraordinary experience when you see people whose lives have become unmanageable, where they've been living out of their car, where they have destroyed the important relationships in their lives, where they have ceased to be employable, where every role that people look for self-esteem has been disrupted, and you watch them get better, and you watch them repair their lives. And there is just so much opportunity in the universe, and you realize that when people stop abusing themselves and stop using, that their ability to create an extraordinary life is really remarkable and preserved.